The truth is, mainstream medicine is not yet agreeing that they're hitting a wall every time. Because when you go to a doctor and says that my pressure is high, what do? They give you medicine to bring it down. And then you take it for 2-3 days. Oh, it is still high. What do? They add another one. But the cells in the blood vessels are not adapting to whatever stress.
Behind the practice.
Welcome back to this week's episode of Behind the Practice. I'm Katie Brinkley, and today I'm sitting down with Stan Makoko. Stan, thank you so much for joining me on the show today.
Awesome, Katie.
Well,
nice to be here.
I'm excited to talk with you because your work flips the traditional healthcare model. Before diagnosing disease or trying to diagnose disease, you're aiming to restore health biochemically and neurologically. So let's dive into that a little bit. Tell us more about what you do and your business.
Yes. So Prodrome Science, the idea is to look at health and not diseases, because we're all healthy. We have cells and organs that are meant to function. And so it's the change from that function under whatever stress we're going on that deviates from health. And so our goal is to understand the deviation of health rather than diseases.
I love that. And so let's talk about restoring health at a cellular and biochemical level, because how do you really develop that philosophy, and why does it matter?
So every day, like us talking now, the body is under stress. And so the cells are trying to adapt to every environment that we stress it under. And there are these lipids that makes the membrane and walls of the cells that helps it to adapt. And so when they are unable to adapt, they lose function. And it is that basis that we develop an important lab test using the ion cyclotron that measures 11,000 biomarkers at the cellular level, and so that we see exactly what the cell is saying to us.
So how did you get involved with understanding cells at this level? This is just, it's an entirely different way of looking at cells. How'd you get involved with that?
So I am an MD, but our main developer, Dr. G, he has a PhD in biochemistry, and he developed the ion cyclotron, patented that knowledge, and that's how I got involved. And what really dragged me into this ecosystem is the understanding of the cellular changes, things that happens at the cell that leads to disease. So our lab, we can measure molecules that we can predict within 1 to 5 years, things that will happen to you. And we fix it from zero.
I mean, you're basically preventing the future.
Exactly.
The future.
Exactly. So mainstream medicine does
Reactive.
reactive medicine. We do real preventive medicine, because the cells are going to have a prodrome. Prodrome is things that happen before damage shows up. For instance, you have a knife in the kitchen and you will see bluntness if you were trying to slice a piece of meat. And so those bluntness, you need to go and file it and make it sharper.
Yeah.
And once you do that, the knife is actually sharp again.
So one of the things that I think people are probably who are listening are probably thinking to themselves right now is, how come I haven't heard of this yet? How come that I can't just go to my doctor and ask for this? Why are we still in reactive mode?
The truth is, mainstream medicine is not yet agreeing that they're hitting a wall every time. Because when you go to a doctor and says that my pressure is high, what do? They give you medicine to bring it down. And then you take it for 2-3 days. Oh, it is still high. What do? They add another one. But the cells in the blood vessels are not adapting to whatever stress. And so mainstream medicine don't have the labs, or they don't want to integrate the research that is out there at the cellular level to integrate into their practice.
So you work with people living with ALS and Alzheimer's, Parkinson's. Talk a little bit about how you communicate realistic expectations while offering hope.
So a realistic expectation is actually based on what people experience as changes. For instance, you have people who have decrease in vision, and so we measure that marker. We have people who have mental disability, not able to focus or process. And so within a month, 2 months, you see those changes. Those are actual measurable outcomes for those clients.
Yeah.
And we don't make a claim for disease treatment, but rather the functionality, because it is a breakdown in function that limits us. So before you were able to lift a 10-pound baby, but now you cannot. And then we do intervention, whole and behold, oh, you can lift a 10-pound baby, you can lift a 20-pound X, Y, and Z. And so it is functionality that improves in these people, and that's real health.
Probably one of the common mistakes that many practitioners make. Well, what do you think one of the common mistakes is that many practitioners make when interpreting biochemical or neurological data is?
I don't think so. So I think, honestly, they get lazy. They get lazy because we have what do you call like a protocol, mainstream protocol. The American Diabetic Association says X, Y, and Z. The American Heart Association says your cholesterol should be under 100 and whatever. But those numbers have no meaning in longevity. So if we look at all-cause mortality, those kinds of limitation is affecting real health care.
Yeah.
Because you can have numbers of 100. I have a number of 300, but yet we still wake up and do things and function normally. And at some point, you might be much more lesser functioning than me, who has horrible numbers.
Yeah.
And so it is the cell that gives us health.
So that led me perfectly to my next question. How does someone know if the therapy they should be seeking is biochemically restorative or if it's just a symptom?
So symptoms are manifestation of breakdown. So you don't have a headache because a headache is a headache. You have a headache because probably your vessels are not able to exchange healthy oxygen for you to have a breather in your brain, and then that's how you have a headache. And so if we restore the cellular level within the blood vessels, you will not have a headache. But if we give you medication, the mainstream medications are things that goes to block neurotransmitters. But how do we know for sure it is that neurotransmitter itself rather than the cell not adapting to what it normally does? So that's where the limit of mainstream medicine. Not to say that it is a horrible approach.
Yeah.
It works for some people.
For certain things.
But it is not a sustainable thing long term, because we still have headache people who still come back again and say that, oh, that is not working anymore. Oh, this is not working anymore.
Man. So if someone's using, your product, patients are starting to see results. What changes for them first? Is it energy? Is it cognition? Is it mobility? What are some of the first changes they should see?
The most important one is energy and sleep. So energy, sleep, mobility, strength and focus, mental clarity is the big one for us. And we use our lab to actually follow the resilience in those changes.
So for someone with a neurodegenerative disease or diagnosis, how do you help them define progress and hope in, measurable terms?
In measurable terms, we use the lab and we measure 11,000 biomarkers. We look at the plasmalogen levels. We look at muscle issues, mitochondrial issues, membrane issues. And we also have our own MRI that has 13 different sequences looking at 600 regions in the brain. And we measure that every 6 months, and you see the changes in real time.
Right.
How the interventions that we do changes the membrane and the functions of the cells in the body.
So I know we've talked about this a few times, but why do you think that the healthcare industry has historically neglected biochemical and cellular drivers of disease?
Katie, to be honest, it is about money. It's about money, yes.
The almighty dollar.
About money. It is about money, because why would you do so? The real cost of healthcare is the repeated visits. You will have a client or patient who comes to you and says that X, Y, and Z is wrong, and then you give them X, and then they go back home and comes back again, and it repeats on them. That is money. But when we do biochemical restoration, the effects are long-term. The effects are much more long-term rather than just chasing a symptom. But mainstream healthcare, and it is a hard thing to say because the information is in there.
Okay.
The information, these are not new things, and it has not been said in the last year, 2 years, but it has been here for hundreds of years. But it is the integration, the merging of the research that exists in health that is not being incorporated. And I think that is a question for The mainstream healthcare
Yeah.
machines.
The machine,
The
yes.
machines.
They are, yes.
Yes. The people who make the decisions of what goes what and what makes sense. But there is a pullback from the economic part of it because there are people who make billions and billions of dollars. And if that crosses over, it shrinks the margin. And so it's all about money.
So if someone's listening right now and they're saying, okay, I've been asking the wrong questions, I'm not looking in the right places, what is the next step for them to take after listening to this episode?
I think people need to empower themselves. We talk about health advocacy. You have to be your own health advocate. And it is to be aware that, oh, I have seen Dr. X, Y, and Z, and I don't feel any different. That is the key. The moment you say that to yourself, get into our ecosystem. Get into our ecosystem, and we're going to blow your mind.
This has been an incredible conversation. If people want to learn more about you, more about your product, and get in touch with you, what's the best way for them to do so?
Prodrome.com. Go to Prodrome.com. We have a network of elites, clinicians. We have about 3,900 doctors in that ecosystem, and you can connect. We also have Engage website. The Engage website, it's engage.com, engage.drgoodenow.com.
All right. And all this will be in the show notes, so be sure to check out the show notes. But yes, continue.
And if you go under Engage, it is an ecosystem that Dr. G has built where people can integrate. Hey, I woke up this morning and I felt black. Is there anyone feeling this? Or what has anyone tried for this? And that is where we are having a lot of traffic.
I love it.
A lot of traffic. And so we can get in touch with you and work out a plan. Absolutely.
Well, I think that this has been hopefully a mind-blowing episode for all of our listeners and got them thinking about what questions they should be asking their doctors. And if things have felt the same, it doesn't need to.
Exactly.
You don't need to feel the same. There's options out there, and you have an entire network of physicians that are ready to help.
Exactly.
So, well, thank you so much for joining me on this week's episode of Behind the Practice.
Thank you, Katie.
Behind the Practice is produced by Next Step Social and Podcasting and hosted by Katie Brinkley and Sean Quintero. A special thank you to our guests today. This episode was recorded live at the Boston BioLife Functional Longevity Summit. A special thank you to the team that helped make this podcast happen.